Hello, dear friends and students. Good evening, all of you. Am I audible to you? Good evening, Sagar Singh Thakur. How are you doing? Good evening, Divya. Good evening, Sagar Singh. Good evening, Shobhan Mandal. Good evening, Psychedelic, Export in 5. Oh, thank you very much, Export in 5. So, yes, Sahana Laskar, Meha Goyal, Aruj Rahat, Neha Soni. Good evening. Oh, thank you very much, Sagar Singh. Subhashri, thank you. Good evening, all of you. So, we have come for the session where we'll be discussing on checklist. This particular session will be a follow-up of this checklist. This session will be tomorrow, that is 4th of August at 9 p.m. Let me remind you this once again. Today we are having a session which is checklist session. The most important topics that you have to cover. You have to cover must know topics for microbiology when it comes to NEET PG exam that is to be conducted on 11th of September 2021. So as a follow-up of this particular session, tomorrow you'll be having this session called as Ultimate MCQs for NEET PGs in infections using images. Before we go for tomorrow's session, 4th August 9 p.m., let me give you a small prelude about what you can expect from tomorrow's session. Listen very carefully. I have distilled out at least 30 MCQs from the previous year questions, and I have modified them in a reasonable manner. It is neither too tough nor too easy. It will be modified. And in every single MCQ which was not an image-based question, I am introducing images into that question. So that tomorrow when you come for the session tomorrow is on the Unacademy Learner app. You will be coming to the session tomorrow at 9 p.m. on the Unacademy Learner app, while you'll be having 30 MCQs, and each MCQ will be backed by an image, and these images will be like the images that you have not seen before. The purpose of showing you these image-based questions is that you will be acclimatizing yourself to different kinds of images in terms of infections. Yes, Vaibhav Trivedi, Greek artist, Swati Gupta, Karthik, Tejesh, Dr. P, Hemanda, Akash Chaturvedi, Vardhan, Dara Krenz. Good evening, all of you. Okay, so before we start our session, these are the regular things that we have to tell you. This is about the Unacademy NEET PG educator. I'm a gold medalist in MD exams and a high octane educator for biochemistry and microbiology for the past 11 years. And I'm a prolific quiz master, and I have placed students in the top 10 institutions and especially the top 10 ranks for AIMS, PG, Chandigarh and JIPMA. So with that experience, I can tell you which topics have become recurrent in case of infections. And there is something called as Plus subscription on Unacademy. You can have access to both live and recorded classes. You can learn from India's top educators, compete in live tests and quizzes. You can study on the device of your choice, and you can have 35,000 plus Access Bank questions, and you'll be having soon printed notes and 12-month and above subscription also. So you can use code Dr. ASM Live if you want to have a 10% off on the Unacademy subscription, and also access to exclusively MIT classes. And there is something also called as Iconic subscription. Here also you can use the code Dr. ASM Live. Thank you very much, Akash Chaturvedi. And there are upcoming batches, Focus FMG batch and Target Next 2002 batch. I'll be teaching here in this particular batch. So you can actually avail the classes if you're a professional MBBS student. And there is a NEET PG test analysis batch for microbiology and biochemistry. I'll be doing the MCQ sessions. Once you have the test session in the morning, you'll be having the discussion in the same evening or the next evening. And this is the grand test. This is for your own schedule. All of them are for free. You can take this grand test schedule. The first test already happened on 31st of July and second on 1st August. So you have the remaining NEET PG GT tests that are available. You can actually avail this goodwill gesture from Unacademy. And they also have a 4-month subscription with 60,000 for Plus subscription and 75,000 for Iconic subscription. And there is a raise a hand option in your live classes, and you can download the Unacademy app, and this is how you can go for subscription using my code. So from now we are going to start the most important topics for the whole of microbiology and immunology. And before we go for anything, if you have any questions, you can ask me. Please let me know if you have any questions right now. Do you have any questions that you want to ask me? Please ask me. I'll give you 1 minute time. You can type your questions before I go for any further understanding of your topics. So I'll be telling you the must know topics leading to NEET PG 2021. Okay, so if you have no further questions, let us begin with this particular topic. First, let us discuss something about general microbiology. Remember, there is a gross difference between what you can expect in case of INICT exams and in case of NEET PG exams. Now, I am pretty sure many people would have been heartbroken after giving INICT exams, and they will be having only one hope right now to give the NEET PG exam and do your best. Now, let me tell you why you should not be heartbroken because of INICT exams. Since I gave my AIMS exams and JIPMER exams in 2009 and 10, that is the end of 2009 and the beginning of 2010, I gave my exams. The AIMS has been the same kind of exam. So please remember, the moment you go into the exam hall, the questions will look like one-liners. The questions will look like one-liners and the options will be very simple. But whenever you think about some kind of choices, you will be able to make the elimination of one or two options, but remaining two options can be always tricky. The problem with those many, that is 60% of people who took the INICT exam will have one common problem. They felt the questions were easy in the exam hall. When they came out of the exam hall, the moment they start discussing the question with others, their heart starts breaking into pieces, because what they expected in the question and what they thought about the answer might have been in the exam hall would be completely different when it was starting to be discussed with that in the case of outside the exam hall area. Why am I telling you this? Because many students, yes, many students will be suffering in case of INICT exam. Have you ever felt that, any of you? That is, initially INICT exam felt good, but the results were disastrous. Did any of you feel that? Yes. Why? Because in case of AIMS exams and PG Chandigarh and case of JIPMER, they do not test your rote memory. Rote memory is not tested in case of INICT exams. Of course, there will be many questions which test your recall memory based areas, and they can be one-liners, but the choice will be between two simpler kind of options which will always be feeling, you'll always feel like you're going to make the wrong one, and when you come outside, obviously it becomes wrong. That is where you actually fail, and that is where you actually think that you're a failure. No, it is not the way NEET PG will be. NEET PG of 2020, that is last year when it happened in the month of January, people were in for a huge shock, because the question paper in that NEET PG exam was completely a lengthy question paper. It was a lengthy question paper in case of NEET 2020. Why was it a lengthy question paper? Because they were not able to pinpoint exactly a particular subject. For example, if you think a question is actually from a biochemistry topic, it won't be a pure biochemistry question. It can be laced with knowledge of infections, or it can be laced with knowledge of pediatrics, or it can be with the help of inborn analysis of metabolism. So clinical questions were extremely high in case of NEET PG 2020. Now, why am I telling you this? This is to recapitulate what happened 1.5 years back. Remember, it happened in last January, not the previous January that went live. It was in 2020 January. So the NEET PG 2021, you can expect lengthy questions. You can expect conglomeration of data. Conglomeration of data and conglomeration of concepts can be seen. Many subjects can come together ultimately to give one question. So if you want to answer this one question, you should be able to have a decent understanding of at least 2 or 3 subjects. For that reason, please understand, infections make a huge call. Infections per se, infections were absolutely difficult if at all you don't understand where infections get inside. So remember one thing, infections will be a part of all clinical subjects. Point number 1, it can be a part of general medicine per se. It will be a part of surgery. It will be a part of pediatrics. It will be a part of OG. It will be a part of ophthalmology. It will be a part of ENT. and definitely it will be a part of PSM when you look at epidemiology of the diseases, especially infectious communicable diseases. So why am I telling you all these things? Because what you expect in microbiology questions in NEET PG, you may not exactly pinpoint to the subject called as microbiology when it comes to these kind of conglomeration. A question can directly enter into pulmonology of medicine, it can enter into the cardiology of medicine, it can enter into the nephrology of medicine. At the same time, the infection can become a part of urology of surgery, it can be a part of inborn error of metabolism in case of pediatrics, it can be a part of genitourinary infection in case of OG, it can be an infection of ophthalmology or ENT. All things are possible. So whatever I'm going to tell you now about the most important topics are completely based on how these kind of topics should be selected by you. So let's begin with the concept of general microbiology. In general microbiology, what are the things that you are not supposed to forget at all? First thing is you have to know the scientists versus discovery. A quick question. Who do you think is Mechnikov? What was the contribution of Mechnikov people? We are not going to discuss it every word by word. We are not going to discuss every word by word of the topic. I'm just going to give you only the checklist of all the important topics. I'm just asking you a random question. Tell me, what is the role of Mechnikov? Anybody? Excellent. So it can be about phagocytosis and reticuloendothelial system. So if, for example, I speak about a birth, you should be able to know there is an organism called as Eberthella, and also you should be knowing Eberth-Gafke bacillus, which will be taken into consideration based on the scientist. And remember, the two major scientists you are not supposed to forget would be Louis Pasteur and Robert Koch. Now, if at all they ask about sepsis and asepsis, you can also speak about Semmelweis. They will ask you questions about Semmelweis, and they'll also ask you questions about Lister. Lister is the one who gave you the concepts of sterility or aseptic precautions in case of your hand washing. So think about the four major scientists: Louis Pasteur, Robert Koch, Semmelweis, Lister, and all the other scientists who were able to discover either a phenomenon in infection or about a microbe in case of infection. Now this is about the beginning of everything. Second, you have to focus on the structure of a bacteria. You have to focus on the structure of a microbe. Remember one thing, when I use the word microbe, you have to focus on bacteriology, virology, protozoology, metazoology, and mycology. On that basis, you should have a basic idea about the basic structure of any kind of microbe. For example, in case of bacteria, you should know the contents present in a gram-positive organism versus a gram-negative organism. For example, aromatic amino acids is a property of which bacteria? Aromatic amino acids is a property of which bacteria, people? Very good, Prithviraj Das. The question is different. I'm asking, aromatic amino acid will be a property of which bacteria, people? Excellent, Divya. It is a property of gram-negative organism. So according to what Prithviraj Das would be saying, gram-positive organism should be known for teichoic acid. Now what I want you to understand is, if they ask you cell wall is a component of which bacteria, is it gram-positive or gram-negative? What is your answer? If we speak about cell wall is a property of which organism? Gram-positive or gram-negative? Excellent. Kribakar and Sagar Singh, Dr. Sayash, Sudarshan, Saram Agarwal, Omkar, Prithviraj Das, and Tanya are the people who have been able to give the right answer. Remember, cell wall is present in both gram-positive and gram-negative. So whatever that is present in cell wall, for example, N-acetyl muramic acid, N-acetyl galactosamine and glucosamine, then you have D-alanine peptide, D-alanine amino acid, D-glutamate amino acid, diaminopymalic acid component. All these are present in cell wall, and that cell wall is very thick in case of a gram-positive organism, thin in case of a gram-negative organism. So both of them will be having this content. But teichoic acid is unique for a gram-positive organism. Aromatic amino acid is unique for a gram-negative organism. This is the level at which you have to know the basic structures of a microbe. Now, if you focus on a bacteria, listen very carefully. Whatever components you find inside the cell of a bacteria can be referred to as an organelle. But technically, organelles are present only in case of eukaryote, and bacteria being a prokaryote is devoid of most of the organelles. But if at all you look at structures coming out of the bacteria, they are called as appendages, because there have been many questions based on the stem. The stem of a question carried the word appendage. People did not understand what is the meaning of the word appendage, because of which they made a mistake. What are the casual appendages that you have to know? You have to know about the structure of a fimbria, you have to know the structure of a flagella, and you also have to know the structure of a particular capsule. Remember, what these three are important heavens of important MCQs. Why? Because fimbriae is a very short structure meant for adhesion. That fimbriae can have different names. For example, it can be called as pilus, especially in case of gram-negative organism, especially when it is known to attack your genitourinary tract. But at the same time, you will be calling them as adhesins with respect to both gram-positive and gram-negative organism. If the same pilus is known to attack the gastrointestinal tract, then it can be called as colonizing factor. These are the variants that can be raising questions for you. When it comes to flagella, what are the most common questions raised? First, they'll ask you about the questions in terms of components of flagella. Apart from asking you questions on components of flagella, you can expect the flagellate appearance of an organism. You should be knowing something about monotrichous organism, ditrichous organism, lophotrichous organisms, peritrichous organisms, amphitrichous organisms. Shall I show you one question regarding this? Shall I just show you one question which can be similar to this? We'll be discussing this question tomorrow. Tomorrow's session, I told you, right? Tomorrow we'll be having a session at, I told you tomorrow, the beginning I told you tomorrow 4 p.m. I mean 9 p.m. So sorry, 9 p.m. 4th of August, ultimate MCQs for NEET PG in infections using images. So I'll just give you a prelude of what kind of question you can expect from tomorrow. Okay, tell me the answer. Name the type of flagellar arrangement in this question. This is the picture. Name the type of flagellar arrangement in this picture. This type of question has been repeated 39 times in the last 10 years. It has been repeated 39 times in the last 10 years. What is your answer? Okay, people are saying B, people are saying C, people are saying D, people are saying E. Okay, so listen very carefully. If I look at a single flagella, I can call it as monoflagellate organism. The moment I use the word trichous, it means we are focusing on a tuft of flagella. So here you see a tuft of flagella, but not just at one end. You can be finding them at both ends. Remember, tuft of flagella can be lophotrichous. Listen very carefully. Lopho speaks about a properly arranged tuft. Trichous speaks about either a tuft or a single flagellum. The trichous speaks about the presence of a flagellum. Lopho speaks about tuft, and if it is present, for example, if a person is exhibiting both right hand activity and left hand activity, you call them as ambidextrous. Likewise, if a compound surface area is exhibiting both hydrophilic and hydrophobic property, you call them as amphipathy. So here, if at all I'm having a tuft of flagella on both ends, I am not only calling them as lophotrichous, it is amphilophotrichous. So this is a question about amphilophotrichous. Listen very carefully. Trichous speaks about flagella, amphi speaks about both sides, lopho speaks about a tuft of flagella. Now these are the types of flagella. And what is the point of learning MCQs? Many students were asking me, what should be my criteria? How should I be focusing on my exam preparation? I'm trying to revise everything, but I'm not able to finish everything. You don't have to worry about it. This is my simplest advice for you. Please try to do 200 MCQs if you're a beginner per day. If you're really very good with MCQs, you can do up to 300 to 400 MCQs per day. But after finishing every MCQ like this, you after knowing the answer for this, it may take 1 minute of time. Then you try to read about the high yield areas behind the topic of this area. For example, polar flagellum, present single flagella present in one pole. Monotrichous, mono is the word applicable for trichous, polar is the word that is applicable for the direction of the side. And if the best example can be for a polar or monotrichous, it is Vibrio cholerae. Who is the cousin sister of Vibrio cholerae who behaves and acts like Vibrio? It is Campylobacter. Who else? Pseudomonas. Now look at Lophotrichous, tuft of flagella at one pole. The next example can be Spirillum. What is Peritrichous? Finding the flagella all over the body can be peritrichous. The best example can be Salmonella typhi and E. coli. When it comes to this particular area, you can have peritrichous flagella, then focus on Amphilophotrichous, alkali genes fecalis and Spirillum. What is the point about Spirillum? Spirillum is an organism who can be found as both Amphilophotrichous and Lophotrichous. That is, tuft of flagella can be found in both ends, or sometimes it can be found in one end. So these are all the different things that you have to understand with one simple question, because this is a very high yield question. You have to know in and out of this question. That is how your preparation should be. Have I made myself clear? If you want to do MCQs, you can always choose an MCQ book, MCQ review books in the market. You can ask me again, which MCQ book is good for which subject? You can go to the nearest bookshop from where you bought your textbooks in college, and there you ask the particular person which MCQ book is very hot selling in that particular subject. You can trust it blindly. Even if it's not a hot selling MCQ book, still MCQ book is always an MCQ book. Even if the explanations are not good or accurate, the questions and the answers can be as accurate as possible, because I don't believe any faculty would actually give you wrong information wantonly. So you can trust any MCQ book on that matter. And if at all you think you don't have time for MCQ books, you can always go back to my particular profile on Unacademy, where I have done approximately 145 to 147 free sessions of MCQs, and all the sessions have only fresh and unique MCQs. You can depend on them. Out of 147 sessions, at least 30 sessions are MCQ image based sessions. You can trust them. Okay, so have I explained it to you? Yes, ditrichous. Ditrichous is actually a misnomer. For example, if I say one person has done something one time, you call it as once. If he has done it 2 times, you can call it as twice. But if it has happened 3, you might use the word thrice, but there is no English dictionary which can say the word thrice. Thrice is not a recognized word. Likewise, ditrichous is not actually a properly recognized word. The equivalent of ditrichous can be lophotrichous. Can you name an example of a trisaccharide? Can you give me example of a pentasaccharide? Remember, trisaccharides and pentasaccharides are not standard understanding of words. The moment it crosses more than 2 sugars, it comes under oligosaccharides. If it is less than 10, the moment it crosses 10, you can call them as polysaccharides. So ditrichous is not a standard word. Lophotrichous is the best word. So I hope, yes, I hope you'll be able to use such kind of logic when you choose the high yield question area. I've just given you an example of how questions can come from high yield area. Now capsule is a high yield area. Let me tell you this, from capsules 174 MCQs have been framed in the last 10 years of exams. 10 years of which exams? AIPGME exams up till 2013 and NEET PG exams since 2014, JIPMER exams that happen twice a year, AIMS exam and PG Chandigarh exam that happen twice a year. In all these exams, the capsulated bacteria and capsulated fungi have raised questions based on 174 different kind of MCQs. So capsule, please remember the capsules when you go for exams. This is my humble request. I beg you, please read capsulated bacteria and go for exams, because you will get them. Also, what is the clinical correlation for capsule? Capsulated bacteria should always be given importance, especially in people who don't have spleen. So asplenia versus capsulated bacteria can cause OPSI, overwhelming post-pregnancy infection. This is how you start linking the concepts of everything. That is, capsulated bacteria logic will be microbiology, asplenia will be surgery plus medicine put together. Now you'll be able to combine infection into medicine and the questions can become seamless. So now what are the things that you have to know about the capsulated bacteria? 1. what are the bacteria which are capsulated and which kind of fungi are capsulated, in which clinical conditions the capsulated bacteria can become dangerous. The third thing is chemical composition of the capsulated bacteria. For example, all the capsulated bacteria's capsules are generally made up of polysaccharides, except in case of Yersinia, which is F1 fraction of a protein, and in case of Bacillus anthracis, which is a polypeptide capsule. These questions can be raised n number of times. And you remember, polysaccharides are carbohydrates with a poor kind of antigenicity, while polypeptides are very strong antigens, and this can be done using Methvedien's reaction. You can demonstrate that using Methvedien reaction. So one is knowing which bacteria and fungi are encapsulated, what is the chemical composition of the bacteria, what clinical conditions can happen because of capsulated bacteria, and how do you demonstrate the capsules. For example, in case of Cryptococcus, you go for India ink preparation. In case of the Bacillus anthracis, you go for Methvedien's reaction. Likewise, you will be knowing how to demonstrate each of the capsule, so that will also fetch you important MCQs. Yes, I hope you'll be able to use this information. These are all important topics. So what have we done in case of microbiology? To understand the scientists and their discovery. The second thing is about the structure of microbes in and out of it, inside the organelles, outside it can be the appendages, and questions based on appendages. The next thing that can be important in case of general microbiology will be sterilization and disinfection. Sterilization and disinfection. What is sterilization? Clearing a particular area, target area, completely of all microbes, whether they are proper bacteria or viruses or fungi or protozoa parasites, or they are the vegetative forms in the form of spores or cysts. Removing everything is called as sterilization. Disinfection would mean to say that you're trying to remove the pathogenic bacteria who are capable of causing infections. Now remember, sometimes sterilization and disinfecting agents may not be mutually exclusive. For example, heat can be a part of sterilization and disinfection. The heat may be dry heat, it can be moist heat. And when it comes to heat, it is a physical method. Likewise, pressure can also be a physical method. Your filtration can also be a physical method. Apart from them, chemical methods also can be used. Now, what are the most important questions raised in case of sterilization? They can give you an instrument, and that instrument, depending upon how it is made, sometimes it can be a plastic instrument, it can be a rubber based instrument, it can be a metal based instrument. Whatever the instrument is, especially in surgery, please understand, in surgical infections they can ask you questions about how do you sterilize the instrument or how do you disinfect the instrument. Generally, ethylene oxide, glutaraldehyde will be used, right? You also have to know something about cold sterilization, where you're going to use radiation as the method of sterilization. Also, what other questions can be raised from sterilization? They can ask you about the indexes or indices. The indices for understanding the efficiency of sterilization and disinfection, and also to understand about the formalin based comparison of the efficiency of other sterilizing agents. Okay, do you have any questions till now? Is my language understandable to you? Is my language, is the speed okay for you? Are you all comfortable with what I'm telling you? Is there anything you want me to repeat? I have very poor handwriting. My handwriting may be very pathetic, so please forgive my handwriting. Okay, thank you very much. So in case of sterilization and disinfection, you can also look at, okay, now they can ask you which bacteria can be helpful, which spores can be helpful, which spores of which bacteria can be helpful to understand the efficiency of sterilization and disinfection. Most common questions can be about Geobacillus thermophilus and Geobacillus subtilis. These two organisms and their spores have been utilized in the understanding of sterilization and disinfection. At the same time, focus on autoclaving. Autoclaving by itself has raised approximately 17 questions in the last 5 years, and sterilization and disinfection by itself has caught approximately 120 MCQs in the last 8 years. In the last 8 years, 120 questions have been framed from sterilization and disinfection. So please do not forget to revise this before your exams. Okay, now the tomorrow's session is on Unacademy app. For those people who want to know how to actually get the link, you can follow me here. This is the Unacademy profile link, and this is the Telegram link. You can join my Telegram channel here or here. One is a channel, the other one is actually a window, and you can join either of them. I'll be posting the links in these two channels, and I will be posting it on the stories of Instagram also. If you'd like to revisit, you can do it. Okay. Okay, so yes, I want you to understand about autoclaving. Apart from autoclaving, you also have to know about your incineration, pasteurization. These are the ones you should be learning. In case of pasteurization, low temperature, long duration, high temperature, short duration. For example, Holder method, flash method, they may ask you questions. So after this, you can go for microscopy. You can go for microscopy. In microscopy, you have to know the basic principles of each microscopy. The simplest of microscopy will be your light microscope, which can be a compound microscope. Sometimes it can be a simple microscope also. Then the next level can be electron microscope. Then depending upon what you're going to add to the microscopy principles, you can have fluorescent microscope, you can have differential phase contrast microscope, you can have negative staining based microscope. All these things will come under microscopy. In microscopy, when you go for every kind of microscope, please try to remember the resolution power of each microscope. Resolution is not the same as magnification. Resolution means the ability of the microscope to clearly identify a particular distinct object as a distinct object. For example, if there are 2 points here, even if I zoom out so many times, still I should be able to make these 2 points as distinct points. The more I go away from this area, the 2 points may look like they are merging. So if a microscope is having high resolution power, it is able to resolve 2 distinct points as 2 distinct points. So the resolution power of each microscopy and the magnification that can be reached by each microscopy can be noticed. Shall I show you one example of an MCQ in terms of microscopy? I won't give you the answer. We won't discuss it in detail. We'll do it tomorrow. But shall I show you one MCQ with respect to that of microscopy? Only if you're okay with this. So you just try to find the answer of this question. We'll meet tomorrow. Just look at this. Look at this question here. Because I'm telling you it is electron microscopy, you will be able to find this image as electron microscope itself. Imagine I did not tell you that it is electron microscopy. Then how would you determine? Do you already know such pictures that they are electron microscopes? If you knew it already, it's well and good. If you did not know it now. That's all. So do not panic before your exams. Do not panic for anything at all before your exams. After all, it's an exam. It may decide the next 6 months of your life, but it won't decide permanently your fixtures. So do not give undue importance and put so much amount of stress on your head so that you will not be able to be yourself. You have been the best all throughout your life, is it not? You are the best for yourself when you are a kid. When you are in school, you are the masters. People thought you are a genius kid, is it not? Ask yourself, every single teacher thought that you are a genius kid in school. And the genius kid was a genius because he or she was able to do his natural flair of activity. You might be very good in singing, but right now you don't have the heart to become a singer or a playback singer. You might be good in playing cricket, but you're not going to become a cricketer at this point of time. But the best thing that you always did and the thing that you're always good with is studies. So when you're studying right now, you are in your most comfortable zone. You are in the zone that you are going to be always the best at. So trust yourself. Do not give undue stress and pressure on yourself. Just relax. If you did not know something while you're studying, know it. If you know something already, make it as a revision. This is my humble suggestion for you. Okay. So what is the answer for this question, people? Among the following, pick out the wrong statement about the given type of microscopy. So in this, I said the given type, right? First thing is you have to understand what microscopy is this. Then if it is a microscopy, based on that, you should be able to pinpoint each of the principles behind this. Okay. So Shruti, Omkar and Divya are saying the answer is C. Okay, so it is A, D. We are asking you about pick out the wrong statement about the given type. If I am saying the option is C, which is A comma D. Electron beam is the source of radiation is absolutely true statement, right? So this is going to tell you one more thing. Please understand, when you are going for your exams, please read the stem of the question at least twice to find out whether they're asking you for the true statement or the false statement, whether they're asking you as a direct statement or an exception statement. If exception is what they're asking, the whole understanding of the question can differ. So on that basis, please do not make the mistake. All of you said C. This is about picking the wrong statement in the given type of microscopy. This is electron microscopy. Electron beam is the source of radiation. It cannot be wrong. And the type of lens is glass. That is also wrong. But D may not be the only thing for it to be wrong. Okay. So we'll discuss this question tomorrow in the session. Now let's go back to the topics discussion. Yeah, so learn about microscopy in detail. Now, if you're done with this particular part, let's go towards immunology. Now, in immunology, what are the most common questions they can ask you? See, immunology can belong to biochemistry. It can belong to pathology. Though it is learnt along with that of microbiology and it is a part of microbiology, it is not unique for microbiology. From immunology, you can go towards pharmacology and also molecular biology. Why am I saying this? Whether you like it or not, it is mandatory that you have to learn about all types of interleukins. All types of interleukins, the source of the interleukins and the function of each of the interleukin. At least try to remember the functions of interleukin 6, interleukin 12, interleukin 2, interleukin 3 and interleukin 9. These are the most common interleukins you have to know. Interleukins. Between the leukocytes, the signaling has been passed very clearly. The WBCs are actually talking amongst each other and this one. And cytokines may not actually be the primary target of your MCQs, but interleukins are definitely important targets for your MCQs. I hope. So what is meant by the source of contrast? Source of contrast, for example, if we say negative staining. In case of the light microscope, generally you can see the background to be white, the organism has a color. Now what do? I add negrosin stain. This negrosin stain will fill the whole field with the color. While the field is filled with a lot of color and is stained, then the organism will not be stained. So you're able to see the organism brighter compared to the background. So what is the source of the negative stain here? The negrosin stain or the India ink is the source of contrast against light microscopy. In case of electron microscopy, electrons are the beams of radiation, while positrons can actually act as the contrast creating components. Likewise, you can concern yourself about different kinds of things which can generate contrast. Okay, again, in case of immunology, interleukins should be a must for you to learn. You have to know at least 5 interleukins and their sources and function. It is good if you know the interleukin source and functions of almost all of them. Sony, no Sony, I'm not going to take this session daily. I'll be taking this session tomorrow, that is on August 4th. And I am planning to do daily sessions after 21st of August, and I am planning to have a relation. Okay, let me ask you a simple question. See, would you all like it if I perform a session based on relationships? If any of you are suffering from relationship trouble, which is actually hindering you from preparing for NEET PG, we'll be having a session which can help you navigate through it. I can talk to you like how a friend will be. I won't behave like a psychiatrist. I'll talk to you like how a brother or a uncle or a teacher or a father will talk to you. If in case you'd like to have, I'll actually have a session for dealing with your relationship troubles. I may not be giving you the best of advices, but I can give you the best of what I know as the advices. In case you would like it, please let me know. Okay, so let's go for immunology as such. The next in topic will be complement system. Complement system is a must know topic. It is a must know topic. You cannot, you should not, you may not ignore this topic. You will ignore this at your own peril. Please don't do this. Read complement system very clearly. And there is a plus course class on complement system. We have done it for 2 hours. If you have time, just go through the PDF notes of it in the plus session itself. You'll be able to find it useful. You'll be having classical complement pathway, alternate complement pathway, mannose binding lectin pathway, and you should know all these pathways will start with which complement factor. You will be knowing C1 to C9. C1 will be broken into C1Q, C1R and C1S, and then you will be knowing there are something called as properdin factor, factor B and factor S, etc. Then they'll ask you very common questions. What kind of common questions are common in complement system? Who is the most abundant opsonizing agent? The answer can be C3b. Apart from the opsonizing agent, who else can be opsonizing agent? It can be opsonins in the form of tufsin and then immunoglobulin G. All these can act as opsonizing agents. And which complement pathway is the common path? Which complement factor is the common path for all the complement pathways like classical, alternative and MBL? It is C3. And which is the first complement factor for the membrane attack complex? It is C5. And if at all there is a C1 esterase deficiency, what kind of disease do you have? In case of any of the late acting complement complex deficiency, for example C5 to C9, which kind of infections will be more common? Especially gram-negative diplococci, that is Neisseria infections, can become deadly in patients suffering from C5 to C9 deficiencies. So you have to know what are the most important things you have to know. You have to know the pathway from which they can raise a question. You have to know the convertases. You have to know the convertases. Why convertase? If for example something is going to act on C3 and break the C3, that something will be called as C3 convertase. If something is going to act on C5 and break it, that is called as C5 convertase. The convertases can be different for the classical pathway, alternative pathway and membrane binding lectin, mannose binding lectin pathway. So know about which convertase is for which pathway. Then you know about the different complement factors. Then you try to understand which kind of complement factor deficiency can cause what diseases. And complement factor is called as labile factor, while antibodies are called as stable factors. Okay. Yes. So next we can go for the other topic apart from complement factors. Yes, travel foodie. What kind of strategy would you want me to say? I think you have joined us just now, Travel Foodie. Travel Foodie, I have answered about the strategy. I have been speaking about the strategy, and in the last 5 weeks, I told you this is the strategy. You can go back and see this in time. You can go back in time and see them. So let's go forward with the concept we were discussing about. I'm sorry. Yes, after complement factors, focus on immunodeficiency disorders. Focus on immunodeficiency disorders. You divide the immunodeficiency disorders into primary immunodeficiency disorders and secondary immunodeficiency disorders. So in case of immunology, you are bound to learn about primary immunodeficiency disorders. Please do not confuse with that secondary disorders. For example, if you have HIV/AIDS and there is immunosuppression, that is secondary. Because of diabetes, if you have suppression, that is called as secondary immunodeficiency. If you have bone marrow suppression because of drugs, that is also secondary immunodeficiency. What is primary? By cause of birth, congenitally or hereditary wise, if there is a disorder in any of the immune system, then you will learn them under primary immunodeficiency disorders. It can be CMI deficiency disorders, it can be humoral immunodeficiency disorders, it can be combined immunodeficiency disorders. Please know the names of each of the syndrome. For example, you can have lazy leukocyte syndrome, you can have Job syndrome, you can also have syndromes like Wiskott-Aldrich syndrome, WASP gene. So likewise, please try to know about each of the syndrome in case of each of the deficiency disorder, and they will make a huge difference in your marking and your scoring. I hope you'll be able to answer them in your exams. Okay, so focus on immunodeficiency disorders. Next, focus on autoimmune disorders. Though autoimmune disorders will come under pathology mostly, you can still focus on them in case of immunology, especially when you think of HLA antigens, and also focus on SLE, systemic sclerosis, as diseases per se. And also remember, Sjogren syndrome can actually fetch you MCQs. Remember, SLE has fetched 440 MCQs across all subjects in the last 10 years. There is no joke. SLE has actually brought in 440 MCQs in the last 10 years across subjects. So focus on SLE and SS. Even if it is not from the point of view of microbiology, please focus on SLE at least from medicine point of view. Okay. Apart from that, what are the other things you have to know in case of immune deficiency disorder? I mean, immunology, you have to know about HLA antigens, MHC, and then you focus on the types of MHC 1 and 2. Then you have to know about the most common questions raised would be about antigen antibody reactions. You have to know what is an agglutination, what is a precipitation, what is a passive agglutination reaction, what is an active agglutination reaction. How can you convert a precipitation reaction into agglutination reaction? That is, if a soluble antigen and antibody come together to form a mass, that is precipitate. If you add a particle to the solute, the solute particles are added, then it can become agglutinate. Particulate antigens can cause agglutination. And Coombs test, direct Coombs test, indirect Coombs test can also fetch you questions. Do you have, yes, do you have any other questions till now? Would you like to know any other question? Do you have any other questions till now? Next, we are going for bacteriology. Please let me know if you have any questions. Okay then, so now let's go for bacteriology. In bacteriology, Harish Rahul, I would be happy to explain you all this, but this is a session on checklist. If I teach you the subject here, we will not be able to finish the checklist of topics that are important for this. Let me tell you, if I add a soluble antigen and an antibody coming together, it is called as precipitation. When I add particles to the antigen, if it becomes a particulate antigen, the result is called as agglutination. Immunoglobulins will come under pathology also. Okay, for that reason, immunoglobulins have actually fetched 120 MCQs in the last 15 years, and most common MCQs have been based on IgM antibody, IgG antibody. The number of MCQs have slightly decreased in the last few years, but it is ideal if you would learn about individual antibody also. Yes, you can do it. Yeah, we'll try to do that, Divya. Okay, in case of bacteriology, what are the rank number 1 and 2 bacteria that you have to know? One would be Staphylococcus, the next would be Mycobacterium tuberculosis. I will not say which one is high yield area, which one is low yield area in these two topics. You have to read in and out of these two bacteria because questions have been framed left and right. From Staphylococcus, at least 70 questions have been asked in the last 10 years. From MTB, at least 500 MCQs have been asked in the last 10 years, and out of the 500, at least 120 MCQs have come only from microbiology in the last 10 years. So you cannot miss Staphylococcus and Mycobacterium tuberculosis. Apart from that, you can focus on Streptococcus also. In case of Staphylococcus and Streptococcus, what is the most important thing you have to know? You have to know the classification of bacteria. Classification of bacteria would mean to say that first you divide them into gram-positive and gram-negative, then you call them as cocci or bacilli, then there is something called as coccobacilli also. Examples you can have Yersinia, Pasteurella, Brucella, Borrelia, etc. I mean Brucella, not Borrelia, etc. Borrelia is a spirochete. Apart from them, you can have typical versus atypical bacteria. Among atypical bacteria, you have to know 7 major organisms like Chlamydia, Rickettsia, Mycobacteria, Mycoplasma, Legionella. Then you will be focusing on spirochetes inclusive of Treponema, Borrelia and Leptospira. So these organisms are a must for you to know before you go for exams. Okay, in bacteriology, what kind of topics would you be expected to answer? Let's go by most common bacteria. In Staphylococci, you have to know about the structures, you have to know about the divisions. you have to know about the classification. Novobiosyn resistant organism, novobiosyn sensitive organism. Again, you can have coagulase positive organisms and coagulase negative organisms. Like to learn about mannitol fermentation test in case of staphylococcus. It is positive for staphylococcus and negative for other organisms. And then catalase test, the biochemical reactions of all the bacteria, at least for staphylococcus, streptococcus, E. coli, etc. So here I told you staphylococcus and mycobacterium tuberculosis are the must. Then comes the gram-negative enteric bacilli like E. coli, Shigella, etc. We'll worry about that later. Now, in case of catalase test, coagulase test, mannitol fermentation test, glucose fermentation test, lactose fermentation test will all make a difference in your MCQs. Many MCQs have been raised in the topics here. Then you focus on the toxins. Please understand, for each bacteria you can have, yes, for each organism you can have an exotoxin and an endotoxin. And if it is a gram-negative organism, exo, endo can be expected. But in case of gram-positive organisms, you expect exo and not generally endo, except in case of Listeria. Okay, then you focus on the most common diseases caused by Staphylococcus aureus. For example, the most common cause of epidural abscess, Staphylococcus aureus. The most common cause of endocarditis, especially in case of native wall, Staphylococcus aureus. The most common cause of osteomyelitis, Staphylococcus aureus. So likewise, you can expect a lot of things. Even in case of bronchopneumonia, the most common cause can be Staphylococcus aureus. So please read about the clinical correlations with Staphylococcus aureus. Next, you go for Streptococcus. In Streptococcus, the first thing you have to know would be grouping. You group them from A to V except I and J. Then under A, you go for typing. Typing can come from M1 till M80, out of which M1, M2, M3 are referred to as flesh-eating bacteria. Under Streptococcus also, think about all the toxins that you know. Think about the delayed type of responses. Then you can think about the hypersensitive reactions happening towards Streptococcus infections. For example, you have post-streptococcal glomerulonephritis. Compare that with that of Alport syndrome, or compare that with that of IgA syndrome. Then you can also have rheumatic fever, equivalent called as rheumatic arthritis. Yes, these are all important. Yes. So you have to know the topics of Streptococcus in detail. Here also biochemical tests you have to know very clearly, and in case of each group the biochemical test will be different. For example, in case of group A, PYR test is important, bacitracin sensitivity test will be important. In case of group B, Quell-Lung reaction can be important. Quell-Lung reaction can be useful to compare the group B bacteria versus that of pneumococcus with that of viridans. But apart from these, group B is known to be known for the tests like CAMP reaction, that is Christie-Atkins-Munch-Peterson reaction, and that of hippurate hydrolysis test. In case of group D, you can look for again PYR test, then you can have esculin, bile esculin hydrolysis test, etc. All these have been repeatedly asked as MCQs. Then we focus on Corynebacterium diphtheriae. This organism is known for exotoxin called as diphtheria toxin, and when you go for each exotoxin, look at the mechanism of action. And when you notice the mechanism of action, you will be able to answer many questions based on that, and then try to compare diphtheria versus diphtheroid organisms. And for the sake of completion, read about Schick's test also. Then in case of the other organisms who are non-sporing but gram-positive organisms can be Listeria. Listeria, remember about refrigeration causing the most important diseases. At the same time, Listeria known to attack your brain. Now this brings us to the question of conglomeration. Look at meningitis. The meningitis can be divided into adult meningitis, adolescent meningitis, neonatal meningitis. In case of adult meningitis, think of pneumococcus. In case of adolescent meningitis, think about Neisseria. In case of neonatal meningitis, think of Streptococcus group B Agalactiae, think of E. coli, think of Listeria, think of Haemophilus influenza type B. All these are known for causing neonatal meningitis. Again, it makes a difference. Okay, then we go for Bacillus. Yes, in case of Bacillus, please learn about anthrax causing organisms and anthrax like organisms called as anthracoid bacilli. All the other organisms which are not Bacillus anthracis but coming under Bacillus, for example Bacillus cereus, Bacillus thuringiensis, Bacillus subtilis, Bacillus thermophilus, all these are anthracoid bacilli. You will be supposed to know, you will be knowing the biochemical investigations and microbiological investigations that can differ between that of anthrax bacilli and anthracoid bacilli. For example, gelatin stab culture method. This gelatin stab culture can be helpful to show inverted fir tree appearance in case of Bacillus anthracis and in case of liquefaction of gelatin in case of anthracoid bacillus. Along with that, learn about the clinical features of anthrax. For example, the most common anthrax would be cutaneous anthrax. The next can be pulmonary anthrax and intestinal anthrax. The most deadliest can be intestinal anthrax and pulmonary anthrax. The least deadliest can be cutaneous anthrax. Likewise, look at the difference between that of anthrax bacilli and anthracoid bacilli. Bacillus is also a spore forming organism. And who else is a spore forming organism? Okay, I'll be slow. Do you want me to go slow, people? I will do that. Please don't worry. Please let me know. Please let me know if you want me to go slow. I'll do it. Yes. So differentiate between that of anthrax bacilli and anthracoid bacilli and try to learn about the different types of clinical understanding. No problem. No, don't worry about it. I'll just go slow. Cutaneous anthrax, pulmonary anthrax, intestinal anthrax. I was just worried. I wanted to cover a lot. That's all. Don't worry about it. I'll do it. Next, focus on Clostridia. In case of Clostridia, tetany brings the most MCQs from the topic, closely followed by botulism, and then it can be perfringens, then it can be difficile. Mark my words, this tetany occurred in case of NEET PG 2021. It came back in November INICT 2020. It came back even in the July 22nd INICT 2021. So please read this topic very well. In case of tetany, look at the structure of the bacteria. For example, tennis racket appearance, drumstick appearance, all these things will be coming under each of the Clostridia, right? Work on them. Apart from that, look at the predisposing conditions for causing this. Most important, look at the mechanism of action of these toxins when it comes to tetanus, botulism, perfringens induced activity and difficile, and know what clinical feature is caused by each of the organism and how do you tackle them. Mostly surgical injuries can be related to this area. Immunization can also be understood from this particular topic. For example, you can have active immunization and passive immunization in case of tetanus, and you will be knowing about that also. So this is about Clostridia, and these organisms are anaerobic bacteria which are obligately anaerobic. And what are the biochemical reactions you will focus on? You will focus on the Clostridia being both proteolytic bacteria and saccharolytic bacteria. Vibrio, I still have not come across, we have not even finished gram positive. We are going for the gram positive sooner. We are going to gram negative sooner. So we have discussed about these organisms. Now we focus on gram negative organisms. In terms of cocci, read about Neisseria gonorrhoeae, Neisseria meningococcus, Neisseria catarrhalis. Look at what are the virulence factors of each of the organism and look at the specimen that you collect for investigation. And once you collect the specimen for investigation, look at the culture media that you will be using for growing these organisms. Then you focus on the bacilli. In case of gram negative bacilli, the most important bacteria would always be E. coli, and the cousin sister of E. coli would be Klebsiella. Both of them can have almost similar features, the only difference being E. coli can run from here to here and it is the world #1 in causing sepsis, while Klebsiella is immotile. It is not capable of running like E. coli, but it is the second most common organism causing sepsis. Now here you will be focusing on biochemical reactions like IMVIC reactions and lysine decarboxylase test. The current topic that is important for gram negative bacteria would be lysine D. Carboxylase test. Read this topic very well before you go for the exam. Apart from that, you will be focusing on Proteus. Proteus is an organism is known for urease. It is known for causing UTI. So focus on that particular topic. Then you can focus on Salmonella. Under Salmonella, we divide them into typhoidal Salmonella and non-typhoidal Salmonella, which is referred to as NTS. Learn about the source of typhoid, the carrier states in typhoid, the types of carriers based on duration and location, then the clinical features of typhoid, the pathogenesis of typhoid. Remember, the most common question raised, aminoglycosides, are they used in case of typhoid? Aminoglycosides are heavily ionic compounds. They cannot pass through membranes. Salmonella can be mostly intracellular, because of which they are not used in case of typhoid. Okay, next you go for non-typhoidal Salmonella, which can be divided into deep-seated infection causing organisms and food poisoning causing organisms. Food poisoning causing organisms can be Salmonella enteritis, and deep-seated infections can be because of Cholerae suis. Focus on them. Then in case of Shigella, read about Shigella dysenteriae, the most prolific organism known for causing direct infection caused as disease, and multiple complications including hemolytic uremic syndrome and sepsis, closely followed by Flexneri, who is known for causing reactive seizures and reactive arthritis. Then focus on Boydii and Sonnei. The one thing that you have to know about Shigella sonnei would be it's a late lactose ferment. Apart from that, you have to know about the biochemical reactions. Maltose fermentation in case of Neisseria, while mannitol fermentation in case of Shigella. And which other organism I told you about mannitol fermentation before we started? Anybody? Which other organism we spoke about mannitol fermentation, people? If you remember, I'll be very happy. Mannitol fermentation should be learned for Shigella. Then for which other organism? Excellent, for Staphylococcus aureus also. Okay, so with this we come to the atypical bacteria, which are Mycobacterium tuberculosis. You have to learn about Mycobacterium tuberculosis. You have to learn about Mycobacterium leprosy. In tuberculosis, you have to know about the antigens, especially the mannose capped glycolipids, and then the important virulence factors like lipoarabinomannan. Then you about the genes like CAT-G gene, EMB gene, VPO gene. All these genes on mutation can give you multi-drug resistance that can fetch you important MCQs. And then learn about the pathogenesis of MTB, and then learn about the clinical features of MTB. But in terms of microbiology, the recent updates in case of investigations, for example, rapid antigen testing. You can have BACTEC methods which have been in vogue for a very long time. You can have radiometric assays. You can have no disk diffusion method in case of multi-drug resistance, but you can go for gene linkage analysis. And you can also go for quantiferon assay called as IGRAS, that is interferon gamma release assay. All the new investigations, you have to know them. In case of leprosy, divide them into the strains of leprosy, which can be starting from that of a spectrum, that is tuberculoid leprosy till that of lepromatous leprosy. Between you can have borderline tuberculoid, borderline lepromatous. Apart from them, learn about Lucio phenomenon. All these things can fetch you MCQs. And think about the cutaneous manifestations of leprosy, the atypical manifestations of cutaneous leprosy, and also neurological involvement of leprosy. Learn about which nerves are very commonly infected, which nerves are actually avoided in terms of leprosy. Investigations are not a very big deal in case of leprosy, but focus on the investigations also. Remember, lepra bacilli cannot be cultured on a external or extracellular media. It can be grown only on a live organism. So know about which organisms cannot be cultured and know about which organism can be cultured. Yes, Dinesh Kumar, Cryptococcus staining will be doing them under Mycology. Okay, then focus on Rickettsia and Chlamydia. Learn about each rickettsial organism and the disease caused by them. mark my words, you will definitely get one question from the topic of rickettsia. I have done a recent MCQ session on rickettsia, and that was Harrison based rickettsia. If you go back and read the Harrison based rickets or look at the session that is for 1 hour, I have taught all the mnemonics regarding the organism versus disease and how to remember based on stories. I am promising you, you can expect one question from rickettsia for sure. In INICET 2021, last month, you had a question on eschar. They asked you among the bacteria or among the organisms who cannot cause an eschar. The answer was KFD cannot cause eschar, while the spider toxin can cause eschar, rickettsia can cause eschar, anthrax can cause eschar, Yersinia pestis induced plague can cause eschar. When you learn about eschar, you can learn about rickettsia also. Chlamydia, you have 3 organisms, right? Chlamydia trachomatis, Chlamydia pneumoniae, and Chlamydia psittaci. You just have to know the classification of each of them, and remember, chlamydia can attack your mucosa. The mucosa can be present in your genitourinary tract, respiratory tract. Generally, GIT is not affected by chlamydia. Also remember, GIT can destroy chlamydia. Also remember, the blood vessel walls can be lined by chlamydia, which can lead to coronary artery disease. This is what you have learned in the last 10 years. So know them also. Now, when it comes to the gross organism called as Vibrio. Vibrio is not primarily a microbiology based topic. It is a conglomeration of microbiology, medicine, and SPM. So read Vibrio cholerae in and out for answering questions on PSM and on case of microbiology. Does anybody remember what was the question raised in Vibrio in the last INICET exam? In case of Vibrio, you have Vibrio cholerae, Vibrio parahemolyticus, Vibrio vulnificus. Parahemolyticus is known for causing food poisoning. Cholerae is not going to cause food poisoning, it is known for causing a disease called as cholera. Vulnificus is known for causing cellulitis. Excellent, Shruti Shanmugam. So Vibrio cholerae question was about the Vibrio cholerae toxin can attack which part. If they had mentioned it is Vibrio cholerae toxin called as choleragen, then that can attack zona occludens zone. If they had mentioned it is just Vibrio toxin, which layer it can attack your junctions, especially the tight junctions of your body. But the best answer would be zona occludens. It can also attack your tight junctions so that it can spread across areas. So what are the things you have to know? All the exotoxins that can be seen in Vibrio, including neuraminidase toxin, and then focus on the mechanism of action of Vibrio toxin, then the clinical features like rice water stools, and then about the culture media. The culture media of Vibrio can be of 2 types. One can be selective media like TCBS agar, the other can be transport media. Learn about them. You are in for a very good treat. Okay, so shall we go for mycology now? Shall we go for mycology now, if you're okay? Yes, Venkatraman Ramakrishnan medium and alkaline peptone water medium. Yes, in mycology, the top stars to be learned would be tinea causing infections, mucormycosis, aspergillosis, candida, and apart from all these things in the recent past, sporotrichosis. So remember, when they speak about rose plant, rose thorns, they speak about gardeners, especially in the hill stations like Himachal Pradesh, think of sporotrichosis, especially when it comes to lymphatic area being infected. Tinea can be of different types. All teniasis you have to know, that will be learning in case of skin and STD itself. Then mucor is the recent organism. Remember, continuous use of improperly sterilized face mask or repeated uses of a uncleaned face mask, use of industrial oxygen, and excess amount of iron intake in case of thalassemia, or iron chelator therapy like desferrioxamine or DKA can all be prone for mucormycosis. And in case of mucor, there is an organism called as mucor irregularis, which is also known to have rhizoids. Rhizoids are a property of Rhizopus. Remember, what are the questions raised about mucor? Mucor is a lower fungi. Mucor is an aseptate organism. The comparison is Aspergillus, which is a septate organism. Aspergillus is having dichotomous branching, acute angled branching, V-shaped branching, Y-shaped branching. Mucor can exhibit almost right angle, especially Absidia and Rhizopus can show you right angled branching. These are the questions raised. In case of Candida, it is a gold standard organism. Know it forever. Do not miss a single question in Candida. Even in this last exam, they asked about Candida gibraltar, where they spoke about drug resistance. Remember, fluconazole was one of the drugs in case of your multi-drug resistance. Yes, correct. So remember about Candida. In case of Candida, learn about albicans from Toto everything. And also you can actually ask about Candida auris, which became famous in the JIPMER 2018 question. I'll write it. Candida auris, which became famous in the JIPMER exam, and Candida gibraltar, which can be multi-drug resistant. Okay, read about Candida and you'll be getting it. Raynaud's phenomenon, chlamydospores, all will be important in case of Candida. Now, shall we go for, these are the must-know topics. You can read everything else, but these are must-know topics. Shall we go to protozoology now? Shall we go to protozoology now, if you're okay with this? Okay, in protozoology, the number one topic will always be plasmodium. Remember about the plasmodial antigen testing and the plasmodial PCR testing that have become very famous. And please read about the blood smear examination. Look at the pictures. For example, you have, in case of plasmodium, the acoliform rings, the headset type of rings, multiple rings of schizons inside the RBCs, all have been picture based questions. Many questions have been raised. What was the question raised in the INECT exam? They gave you a bone marrow aspirate of a patient who was a traveling person, and in the bone marrow they showed about the LD body. LD body is about the reticuloendothelial cell capable of exhibiting the amastigote form of this organism. That was the MCQ. So plasmodium, especially plasmodium falciparum, you cannot go to the exam without reading this. And also, as a combination between that of microbiology and pharmacology, read about the drug of choice for uncomplicated malaria, complicated malaria, multi-drug resistant malaria, and uncomplicated, all these things in case of pregnancy and children. All these things will definitely fetch you at least one MCQ. Mark my words, you will get one question from malaria, either as a part of pharmacology or as a part of microbiology, or each one. So you cannot miss plasmodium at all. Babesia is rare, but they can ask you questions about the Maltese cross, Babesia divergens, Babesia microti. Just try to remember at least the species present in Babesia. Okay, now what about the other kind of protozoa that you have to know? In case of protozoa like Leishmania, try to learn about the different species. Leishmania donovani, Leishmania tropicana, Leishmania brasiliensis, etc. Remember, Leishmania donovani is known for causing leishmaniasis, while Calymatobacterium donovani is known for causing donovanosis. Calymatobacterium donovani is known for causing donovanosis, which is right now referred to as Klebsiella granulomatous. Okay, and try to learn about the cutaneous leishmaniasis and visceral leishmaniasis. And in case of STD and OG, they can ask you questions as a combination for Trichomonas vaginalis. Look at the structures of Trichomonas, look at the flagella present in Trichomonas, and please focus on a topic called as undulating membrane in Trichomonas vaginalis and Trichomonas coli. Also focus on the recent question in Leishmania was about the antigen. Okay, you will be having a 49K and a 39K antigen, which was done for antigen testing, and you will be having aldehyde test being done also. Focus on those questions. Sir, you are an intern, appear in NEET PG 2022. I want to score 2025 rank in NEET PG. What should be my approach? Yes, Vikram, I'll answer your question very quickly. For those people who are targeting NEET 2022, this is my simplest of advice. Please split the time duration. That is, you have exactly 9 months at your disposal, and out of which you select 6 months and break the 6 months for 19 subjects depending upon your heavy weightages, and then the last 3 months for your revision. You have to revise for 3 months. In the last 3 months, don't try to learn anything new. In the next 6 months, when you're going to read, please focus on this particular ratio: 50% theory, 50% MCQ. If you're going to read for 10 hours a day, 5 hours will be spent for theory, out of which 4 hours will be for first time reading and 1 hour of revision for the theory. And again 4 hours of functioning of MCQ solving, and then 1 hour of taking notes and revising the MCQ information. Collect all these things every single day. At the end of each month, select 2 days to revise whatever you have done in the last 28 days. Whatever it is, just revise for 2 days every single month, whatever you learned in the 28 days of the other thing, and you will be definitely a winner. I wish the best for you, Yash Vikram. Okay. Now apart from that, you will also have questions in case of amoeba, Entamoeba histolytica, Entamoeba coli, Entamoeba fragilis. All these things can get you questions. Here you will be having amoebiasis. The questions in case of amoeba will also be based on investigations, whether you will be using the imaging modalities or you'll be going for biochemical investigations, or in case of microbiology investigations. Rapid antigen testings are available and antigen kits are also available. LDH can be done, and LDH type 2 can also be tested in case of entamoeba. PCR can be done in case of entamoeba. All these things are possible in entamoeba. Apart from that, you can also focus on cyclospora, cryptosporidium, isospora. Please keep on revising about the cysts of each organism versus the trophozoites of each organisms. So we have come to the, you're a mother of 5-year-old, already given 3 times exams. This time you have prepared comparatively better. I need to get a good rank. Please suggest strategies for a better clinical subject. Yes. So if you're going to give the NEET PG exam right now, please sit together for at least 6 hours a day. Apart from all your functions, work for 6 hours, out of which 4 hours will be for solving MCQs and 1 hour is for taking notes of new information you learnt in these MCQs and writing them, and 1 hour in revising it. So every single day try to do 200 MCQs with a rapid revision area, and 200 into 30 days should fetch you approximately 6000 MCQs, and in the last 10 days revise the 6000 MCQ worth of information. You will be getting your best results possible. Okay, now we are going for the last leg of our session, which is Helminthology. Oh, we have virology also. Yes, just give me 5 more minutes. We'll wrap up the session in just 5 minutes. Is that okay, people? We'll finish the session in just 5 minutes. Can you be patient with me? So, in case of hierarchy, number 1 should go for nematodes. In nematodes, we divide them into filarial and non-filarial. In case of filarial, we divide them into lymphatics and non-lymphatics. The non-filarials can be hookworm, roundworm, and strongyloides. Then you can think of Enterobius vermicularis, etc. In Helminthology, the one thing you have to know is the eggs of each worm. You have to know them very clearly. And for you, I can just give you, and for each of you, I'm giving you a simple suggestion. If you search for Dr. Meenakshi Sundaram, he is on the YouTube channel itself. Parasitology MCQs are being done, and there is a separate session on eggs. You'll be able to see them. We have discussed about the images in parasitology separately, and Harrison-based parasitology is also done. You can go for them. And in case of nematodes or trematodes or your cestodes, please read the life cycle. And what are the MCQs learned from the life cycle? They will ask you who is the intermediate host and who is the definitive host. If you learn the life cycle, you'll automatically know. Some of the times you may have more than one intermediate host. Many times you'll be having one intermediate host. That is a definitely important thing. Okay, so life cycle and eggs. If you can do this thing very carefully, please look at the, now in case of Helminthology, look at as many images as possible. Tomorrow's session, that is August 4th, 9 p.m. session tomorrow, we'll be discussing approximately 30 MCQs, out of which 5 MCQs will be images from that of parasitology. So come prepared for that. Images can be done tomorrow. This session is on the app. Again, tomorrow 9 p.m. on the app, we have 30 MCQs. All of them are based on images, and you will be having rapid revision. Okay. Now look at this part. Look at this part. In case of Helminthology, the done and dusted part is, in case of drug of choice, generally albendazole can be done, but apart from them, you can have trematodes and cestodes having praziquantel, niclosamide, etc. So just cover up the drugs. These are not very difficult drugs to remember, but they will ask you the questions in your exams. Now let's go for the last leg called as virology. In virology, what are the most important questions raised? Which kind of part of the egg is used for inoculation when you want to make vaccines? Okay, this is one important area for questions. Then they can ask you questions from the kind of cytopathic changes caused by each kind of virus. For example, enteroviruses can cause total sheet degeneration. Pox viruses can cause non-necrotic pox. Those kind of cytopathic changes can raise questions. Apart from that, the culture media meant for viruses, read them also. Also remember the phenomena that you see in case of viral replication. Learn about the viral replication, the speed with which viruses will replicate. For example, von Magnus phenomenon can be learned in case of virology. Then the most important part of virology questions will be classification of viruses. Remember, DNA viruses are the ones who are mostly known to exhibit latency rather than that of RNA viruses. In case of DNA viruses, focus on hepatitis B, focus on pox virus, focus on herpes simplex viruses 1 to 8. You read and revise these kind of topics as many times as possible. Others you may actually let go, but these you cannot actually let go. Also remember, parvoviruses have actually become important in the last 5 years. In case of RNA viruses, without needless to say, read about SARS-CoV-2. At the same time, try to read about the SARS-CoV, the previous SARS virus. Also read about the MERS, that is Mediterranean respiratory syndrome viruses. You can actually expect questions. Polio viruses can be framed from questions. Measles can be framed questions from. You can also have, see, polio, you cannot say no to it. HIV, you cannot say no to it. You have to know in and out of these two viruses. Apart from them, you can expect hepatitis C virus, which can raise you questions. So these are the, yes, I said von Magnus phenomenon. I'll write it here, where you can have ghost-like particles coming up. The infectivity of a particular virus particle will go down because of multiple replication. So I have given you as many things as possible. These are the most important topics you should be evolving. I'm not saying you should not read the others, but if you're going for the exam, these are must-know topics that you can go for the exams with. So I hope it has been helpful for you. So all the people who are here, let me tell you, this is the